Good midday. It is Wednesday, February 18th, 2026. This is the Health Subcommittee. Members, if you don't mind logging in and taking roll. Sir, Mr. Clerk, if you don't mind opening the roll. Mr. Clerk, take the roll.
Mr. Chairman, you have 7 members present. You have a quorum.
Thank you, Mr. Clerk. Personal orders from the committee. Chairman Williams, you recognized.
Thank you. I just wanted to recognize somebody in the crowd who happens to be my nephew, Grant William Gammon, right over there. Helped him change one of his diapers when he's little. I did not know he was going to be here today, but I'm happy to see Grant here, and I will let your mom know that you were present and accounted for. So, Grant William Gammon.
And I do have, I see the athletic trainers are here for your day on the Hill, so welcome you guys to the Health Subcommittee. And I challenged you guys last week for the members on this board. We're about to go around and tell me one thing y'all have done since last year that made you more healthy for Tennesseans. And I'm looking at you first, Chairman. What do you got?
Well, I hate to admit this, but back in October, I started fasting the first 3 days of the month because I thought it would help nutritionally. And when I got here, I had no gray hair, so I'm hoping that helps with that as well.
There we go.
Yeah.
That's pretty good.
Thank you, Chairman. I guess right around the time that I turned 50, I started feeling like I needed to do something. So I started working out. But over the last summer and especially 4 or 5 weeks, I have really stepped it up and done more stretching and trying to get my old body that's been working hard for a long time to feel a little bit better. So I guess that's where I'm at. Thank you, Chairman.
Representative Hill.
Thank you, Chairman. The items are so numerous that I simply cannot mention them here.
Representative McKenzie.
How can I follow that? I have gotten back into spin class cycle, and it's my knees are bad, so that's really a good exercise that's not hard on my joints. So trying to do that at least 3 days a week.
I love it. Representative Mitchell.
Well, in 2020, I was turning 50, and I said I was going to get in shape, and then COVID hit, and it went all AWOL there. So last year, I was turning 55, and I decided in March I was going to get in the best shape of my life before I turned 55 in September. So I started dieting, working out. So I lost 60 pounds between March and September.
Hey, there we go. And Chairman Terry.
Thank you. I cannot beat that. But so for years, you guys will see me stand up on the House floor. You see me stand up in committee. I'm always closing my rings. And but every morning I get up, I do yoga and Pilates. And for the last 20 some odd years, my son and I have gone on a ski adventure. And we just completed that this past week. And so I still was able to get down some black diamonds. And so part of my workout is, so while everybody was worrying about what the halftime show was for the Super Bowl, I was doing wall squats and burpees.
There we go. Absolutely. Great deal. Well, I'm 100 miles in more than I was last year running from this point last year. So making sure we continue to stay active and run. One thing we've talked about in Tennessee, what we want to do is these men and women up here have to lead the way for our state to become healthier. So that's why I challenged our group, for y'all listening and watching, to make sure we start doing things from our standpoint to lead the way in health as well. If we're going to encourage our citizens, it needs to start with us up here. So the power given to me, thankfully, from Speaker Sexton, I do have a special award today for our MVP of the Health Subcommittee, Health Sub MVP of 2026. This gentleman lost a third grader. Representative Mitchell, you are the winner. I'm proud of you. So that is our goal, everybody. That's right. My son is 64 pounds, so he's lost a third grader. So he, put that on your trophy case and all you guys get reelected, and then we can encourage the speaker to put us back on this, and y'all can go after the 27 award next year. So that'll be your goal. Without any further issues in front of us, we'll get rolling. We have a busy calendar today. First and foremost for business, House Bill 2088 has been rolled 2 weeks. House Bill 2398 rolled 2 weeks. House Bill 2166 rolled 2 weeks. House Bill 2195 rolled 2 weeks. And House Bill 1944 has been rolled 2 weeks. This gets us back to the start of our regular calendar. House Bill 2044 by Speaker Marsh. You are properly recognized, sir, and I believe you have an amendment.
Chairman, I have amendment 13463.
All those in favor of the amendment on, say aye. Aye. Opposed? No. Ayes have it. You are properly before us, sir.
Thank you, Mr. Chairman. The amendment just makes some small spelling corrections is all that does, but the House Bill 2044 is a simple, necessary cleanup bill that brings last year's medical assistance legislation fully in line with real clinical practice. First, it corrects an oversight by adding physician's assistants as authorized providers who may delegate tasks to certain certified medical assistants, something they already do in outpatient settings but were accidentally left out of the statute. This bill clarifies that clinics are responsible for training and verifying competency for medical assistants, ensuring safety without adding new regulations or burdens. It updates the inclusion and exclusion list so clinics know exactly what medical assistants can and cannot do, adding clarity around vaccines, oral and topical meds, limiting anesthesia, and making clear they cannot administer anesthesia gases or cosmetic agents such as Botox. Finally, the bill modernizes medication rules by allowing medical assistants to work with both single-dose and multi-dose medications so long as the provider orders a specific dose and performs any needed calculations. This replaces the outdated standard dose language, which doesn't reflect real-world prescribing for common weight-based medications like Tylenol. In general, HB 2044 improves safety, clarity, and efficiency, and I appreciate your vote.
Thank you, Mr. Speaker. Questions before the committee? Not seeing any. Sir, open the vote for. All those in favor of House Bill 2044, press aye. Opposed, no. Any member wish to change their vote? I guess I should vote. There we go. Mr. Clerk, take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
The ayes have it. House Bill 2044 moves on to health full.
Thank you,
Congratulations.
Mr. Chairman. I really appreciate Chairman Terry not asking any hard questions. These medical terms that I don't know.
This brings us to item number 3, House Bill 1954 by Representative Helton Haynes. Motion second. No amendments. You are properly before us, ma'am.
Thank you, Mr. Chairman. Last year, we passed Public Chapter 295, which would allow some mid-level providers to prescribe Schedule 2 or 3 drugs under very limited circumstances. And there was a technical error in Section 2B. It read, is employed by or contracts with a state correctional facility or a county or municipal jail to provide healthcare services. It should have read, is employed by, contracts with, or subcontracts through the contracted healthcare vendor with the Department of Correction or a county or municipal jail to provide healthcare services. We don't contract with a state correctional facility. The contracts are with the Department of Corrections, and this bill just makes that technical change. And with that, I stand for questions.
Thank you, madam. Any question on the bill has been called? Sir, Mr. Clerk? All those in favor of House Bill 1954, press aye. All those opposed, nay. Have all members voted? Any members wish to change their vote? Mr. Clerk, take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
The ayes have it. House Bill 1954 moves on to health full.
Thank you.
This brings us to item 4, and Representative Slater is not in at the moment. So this brings us up to item number 7, House Bill 2599. Representative Shaw. Motion and second with no amendments. You are properly before us, sir.
Thank you, Mr. Chairman. Thank you, members. I want you all to know that this is the first time in 25 and a half years I've come before this committee. I'm honored to be here today, and really I'm honored for the legislation that I'm carrying today, because I think out of all of the legislation that I've had my name put on or tried to carry or support, this is probably the greatest bill of all. And what this does currently, as you know, that there's about 129,200 Tennesseans currently living with Alzheimer's and dementia. And of course, this legislation will continue the pilot program that Chairman Williams carried a bill for back in 2022 to continue to provide the hospice care that is needed for those who are suffering with dementia in the state of Tennessee. And I'm very honored because I've had a personal relationship with this situation in my own home. So I'm really honored today to carry this bill. And before I say too much, I want to stand for questions, and hopefully that you'll give me approval of it after we answer any questions you might have.
Thank you, Representative Shaw. I'm more shocked you haven't been in front of this committee in 25 years, but greatly appreciate your service in this bill. So yes, sir.
I think it's because I'm in such good health.
That's right.
I don't ever have to come before this
You would have
committee.
won the award from Representative Mitchell for sure. Chairman Williams, you're recognized.
Thank you, Representative Shaw and I have had, this is, I guess, 15 or 16 years that we've served together up here. So, and I've been in health the entire time. So I'm really impressed that you finally got here. But he is correct. This is a bill that we got a lot of support for. It's very personal to him now, personal to me, my family, my grandmother. You know, this is a program that other states have done and have grown over time, because whenever we provide respite care to families so that they can go and get a haircut and run to the bank and go to the grocery store and somebody could sit with their loved one, it keeps those people from being in long-term care facilities where they're not going to get the same level of care and love that they would do. And so this has been a really good program. It's a pilot program to see how it was working. The results are of that study are due any moment. And Representative Shaw came to me and told me how passionate he was about this. So we hope to continue to do it. It's really Alzheimer's is harder on the family than it is on the patient. And it's very difficult to walk. It's a long walk. In a lot of ways, families seem to be alone, and this gives them a little bit of respite. So I'm happy to support it. But thank you, Representative Shaw, for bringing this bill back.
Thank you, Chairman. Thank you. I'm very honored.
Any further question? Not seeing any, we'll vote. Mr. Clerk, all those in favor of House Bill 2599, press aye. Opposed, no. Mr. Clerk, take the roll or vote.
Mr. Chairman, you have 7 ayes and 0 nays.
The ayes have it. House Bill 2599 passes. Congratulations, Representative Shaw.
Thank you, Mr. Chairman, members.
Up to full, yes, sir. This will bring us back up to number 3. Now that I see Mr. Slater. Nope, number 4, House Bill 1899. Chairman Slater, you are recognized. Well, actually not. Motion second. Now you're properly recognized, sir.
Thank you, Mr. Chairman, and thank you, committee. This bill that comes before you this morning has to do with residential homes for the aged, which may be an unfamiliar term to you. So let me explain. Residential homes for the aged support older adults by helping them secure permanent housing. This choice is often the best option for seniors to continue to live in their community and live close to their family members. Residential homes for the aged are licensed by the Tennessee Department of Disability and Aging or the Tennessee Health Facilities Commission based on the number of residents. This bill increases from 3 to 5 the maximum number of individuals that may live in Tier 1 home for the aged, subject to licensure by the Department of Disability and Aging. It increases from 4 to 6 the minimum number of individuals that may live in a Tier 2 home for the aged, subject to licensure by the Health Facilities Commission. In consultation with various departments, including the State Fire Marshal's Office and the Department of Disability and Aging, they confirmed that health, safety, and security of individuals is not compromised with this change. And with that, I stand ready for questions.
Thank you, Chairman Slater. Chairman Williams, you're recognized.
Thank you, Representative Slater. Just a quick question. Are in either one of these licensed facilities, is it a requirement for there to be a resident there that's caring for them, or that's not necessary in either?
You're represented, or you're recognized.
Yes.
Sir.
So these homes for the aged, yes, they do have staff members that are there at the home. That is correct.
Okay.
Did that answer your question
Yes.
completely? Yes.
Any further questions for the sponsor? Representative Mitchell?
Yeah, thank you, Mr. Chairman. Yeah, and I totally support these homes and things. I've just had a problem in my community where people are putting these into neighborhoods, and it does increase a lot of traffic in a street on a home that's meant for 2 cars in the driveway, and all of a sudden now you've got, instead of 3 people living there, you've got 5 people living there, and their family members are coming to visit. Currently they're not required to notify the neighbors or anything that they're about to do this in their neighborhood. I just, we've got the opportunity now with your bill here that I think we, going forward, if you would consider looking at maybe giving some type of notification to a neighborhood, within so many feet of that home before they open one of these up. I think that would do well for all the citizens of the state. But I support your bill, but I just think we got a great opportunity right now. It just happened 2 times in the last couple of years in my community, and it just puts neighbors. The neighbors are all supportive of these folks, but they also live in a neighborhood and wasn't expecting 12 cars to be out front of their house all the time now. Thanks.
Representative, you're recognized.
Thank you, Mr. Chairman, and thank you for the question. I've had opportunity to visit residential homes for the aged in my community and in my district. In fact, Mr. Chairman, if you'd allow, I'd like to recognize the Turk family. There you go. And they operate residential homes for the aged. And I've been to those homes. I've not seen the situation that you've described in my community. I'm not saying that it doesn't exist. I think my response to that would be, though, that the Department of Disability and Aging, this is a licensure and an application process. So during their rulemaking and those types of things, that may be something that they would consider. I don't think that I would like to consider putting that in legislation and then taking place across the state, especially in communities where that's not been an issue.
Any further questions for the sponsor? Not seeing any. Mr. Clerk? All those in favor of House Bill 1899, press aye. Opposed, no. Mr. Clerk, take the roll.
Mr. Chairman, you have 7 ayes and 0 nays.
The ayes have it. House Bill 1899 moves on to full Health Committee.
Thank you, Chairman. Thank you, Committee.
I'm going to go slightly out of order one more time. House Bill, or number 12, House Bill 2020 by Leader Cochran.
Motion.
You're properly there, and you have an amendment, I believe, sir.
Yes, thank you, Chairman and Committee. Amendment drafting code 013486.
Motion second. All those in favor say aye. Oppose?
Aye.
Ayes have it. Yeah, you're properly before us now.
Thank you, Chairman. Committee, I know many of you are familiar with Isaiah's House. It's an organization that helps house minors who may be in DCS custody, but it gives them housing until a more permanent setting is there. One of their big fundraisers each year is our lemonade stands across the state. There were a couple places last year where we ran into some issues of some lemonade stands being shut down, and it wasn't even really the Department of Health's fault. I don't know who reports an Isaiah's House lemonade stand, but someone had reported them. And since they were operating on sequential days, I think I'm telling you correctly here, since it wasn't like Monday, Wednesday, Friday, since they were going in sequential days, they were technically in violation of this obscure code here. This is correcting that, just to make sure that if you're a 501c3 that does this for minors, you can have a lemonade stand. I know.
Sugar-free, of course, for the Health Committee, right?
Sure.
Yeah,
Yes.
perfect.
Yeah.
Any questions for the sponsor? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 2020, press aye. All those opposed. Mr. Clerk, take the vote.
Mr. Chairman, you have 6 ayes and 0 nays.
The ayes have it. House Bill 2020 moves on to health full.
Thank you, Chairman. We'll bring you a cold glass whenever
That's
we do
right.
those. Thank y'all.
This gets us back to number 8 on today's calendar, House Bill 1984 by Chairman Hill. Motion. There we go. Motion second.
Thank you, Mr. Chairman and committee. House Bill 1984, it allows nurse practitioners and or physician assistants to prescribe an injectable monoproduct of buprenorphine. The goal of this legislation is something that is a difficult issue to discuss, but it's diversion in making sure that people that are in need of this particular prescription, this particular drug, are taking it properly. And we're going to put this in the hands of those providers to make that call on behalf of their patients. And pending any questions, I'd seek passage.
Thank you, Mr. Chairman. Any questions for the sponsor? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 1984, press aye. Opposed, press no. All members voted. Any members wish to change their vote? Mr. Clerk, take the vote.
Mr. Chairman, you have 6 ayes and 0 nays.
The ayes have it. House Bill 1984 moves on to health full. This will bring us over to item number 10, House Bill 936. Not seeing him, so we'll roll that 2 weeks. Number 11, House Bill 2145 by Chairman Terry. You are properly recognized, Mr. Chairman.
Right, thank you. And this is the Respiratory Care Interstate Compact. And as the members may be aware, Tennessee is involved in many healthcare-related interstate compacts, including those for physicians, nurses, and physical therapists. This compact is for the respiratory therapist. These compacts help healthcare professionals to expedite their credentialing process without sacrificing quality, thus improving Tennessee's access to a critical healthcare workforce. And I stand ready for questions.
Thank you, Mr. Chairman. Any questions for the chairman? Not seeing any. Mr. Clerk, please open the vote. All those in favor of House Bill 2145, press aye. Opposed, no. All members vote. Any members wish to change their vote? There we go. Mr. Clerk, take the vote.
Mr. Chairman, you have 6 ayes and 0 nays.
The ayes have it. House Bill 2145 moves on to health full. This brings us to item number 12, and I will pass the gavel down to Chairman Terry.
Let's see. Find out where we are here. Very last page. Okay. There we go. All right, House Bill 2021. Chairman Martin, you have a motion and a second, and you have an amendment.
Sir.
Amendment drafting code 013110. Is that correct?
That is correct.
You have a motion and a second. All those in favor of the amendment, say aye.
Aye.
Opposed? Ayes have it. We are on the bill as amended.
Thank you, Chairman and Committee. This bill comes to you today from our friends, the podiatrist, a little scope work that they've been working on for 30 plus years, I think. It's been a good while since they brought anything to us, but this one's a cleanup component to allow them to treat soft tissue up to the tibial tuberosity, which is just below the knee. And it says only soft tissue components. So I think that is where we're at, and I renew my motion.
Do we have any questions? Okay. Representative McKenzie, you're recognized.
Thank you, Mr. Chair. And just not being a medical professional like you all are, just want to make sure that soft tissue doesn't include intervened or anything like that, right? It's just the muscular areas of the calf, I guess, which is the extension part.
You recognize?
That is correct, Mr. Representative. Just soft tissue portion.
All right. Any further questions? All right. Seeing none, before we vote, I do want to thank the podiatrist and for bringing this to our awareness and working with everybody on this, and look forward to voting for it. So will you please open up the board? All those in favor vote aye, opposed vote no. All right, clerk, take the roll.
Mr. Vice Chairman, you have 6 ayes and 0 nays.
All right, thank you. And the House Bill 2021 passes and moves on to full health.
Good deal. Thank you. That brings us to the end of the calendar. Any other business before us? Not seeing any. Without objection, we stand adjourned.